Welcome to the Vascular Voice, a podcast devoted to demystifying your vascular health. We're going to talk about things associated with PAD, also known as peripheral arterial disease. These things are the things that matter to patients who have PAD or are at risk of developing it. I'm your host, Dr. Jeff Martinez. My co host today is Christina Hudson.
Thanks for having me, Doc. This should be a fun episode.
Well, it's fitting that we're launching this podcast this month because September is PAD Awareness Month.
Well, maybe we should start with, what is PAD?
PAD is peripheral arterial disease, and that's when you develop fatty plaque inside the walls of the blood vessels. As that plaque develops, it causes blockage in those arteries, and that blockage can lead to problems in the lower extremities. Now, this fatty plaque can develop in all the blood vessels. It's the same type that you develop in the heart. You can develop it in the neck that can lead to strokes. But we're going to confine our discussion to really PAD involving the lower extremities or in the legs.
Okay, so what kind of things can happen when you have PAD?
So I think the first thing to know is that maybe nothing. So about 40 to 60% of patients are asymptomatic, meaning they have no idea they have PAD. And that's not a bad thing. There are three major societies that deal with PAD, and all three of those societies agree that patients who have no symptoms need no treatment. Now, the bad thing is that you've got it and you don't know it's there, and that the disease can progress over time, leading to things such as leg pain, limitation in their ability to walk or get around, ulcers, gangrene, infections, and even loss of the limb, and in the worst case scenario, even death.
Can you share your journey into the field of vascular surgery with us? Maybe what drew you specifically to the area of medicine?
Sure. So after medical school, I did a general surgery residency. So that's additional training to become a surgeon. And during that time, it's 5 years of training. We spent time on the vascular surgery rotation. About a third of our time is spent on that rotation, and that's really kind of where I got to like and enjoy that part of the specialty. I think for most surgeons, when we treat patients, you treat the condition with surgery. It's usually a short-lived thing. They recover, and then you don't see the patients. With vascular surgery, because we can't cure the vascular disease, they become a chronic patient. So you over time you get to establish relationships with the patients, and I really like having that rapport with patients, seeing the patients over and over again in the office. And I think it's really important, because we cannot cure vascular disease, is to get to know your patient, because then you're able to make a good decision on when the patient really needs intervention or not. And so in the end, it works out best for the patient and for the doctor. And it's 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 a good feeling seeing patients over and over, and knowing that you're helping and taking care of them.
Great. All right. Well, you've been treating patients for a number of years in this community. Can you share with us a success story?
So there's a lot of ups and downs when you're treating patients with vascular disease. Sometimes, despite just your best efforts, things don't go the way you want them to go. People can still lose their leg, and it can be a variety of reasons. A lot of folks may present late, so it's important to catch the disease early. But also, some of their comorbid risk factors can have a huge impact on the outcome of the disease. So, seeing patients both with their successes and with their failures is something that we have to deal with every day. I will say that we've recently seen a patient who had been treated by another physician and told that there wasn't anything more that could be done, and he was going to lose his leg. Fortunately, we were able to reevaluate him and uh, reconsider kind of what had been done for him. And we were able to intervene, and we did save his leg. So that's really kind of the best story that you can have, and one that we always cherish. It's a big deal when you can have that kind of an impact on somebody that really is a limb saving and a change of life for that person who was really in a lot of despair.
Well, what are some of the latest advancement in treating PAD, and how do you and Espada Vascular incorporate these into your patient care?
So most of the open vascular procedures have been around since the 1950s, really in the era of the Korean War and Vietnam War. A lot of these procedures were developed, and most of those are still around today from an open standpoint. But the minimally invasive side is what's been the newer thing, and it's constantly changing. So you can break down the treatments that we do that are minimally invasive into kind of three broad categories. One is balloon angioplasty, where we're using a balloon to expand the channel and open that blockage up to allow more blood flow through. Another one is atherectomy, where we're actually shaving the plaque off or we're debulking that plaque to open up that passageway. And then the last is a stent or kind of a scaffold to hold the channel open and keep it open. So almost every treatment we have falls into one of those categories or a combination of that. Now, for the balloon angioplasty, we have some that are just plain old balloons that we use, but the development has been some cutting devices on them to help um, crack that plaque and allow the balloon to expand better. Um, there's other balloons now that use lithotripsy, so the same sort of technology that's used to bust up kidney stones is available on a balloon. So we can insert that balloon, especially into a heavily calcified blood vessel, and it cracks that plaque in order to open it, and it does it in a stable environment that it doesn't disrupt the blood vessel wall. That's been a very promising technology. And we also have the use of drug coated balloons. So the balloons are coated with a drug to retard the narrowing of the blood vessels. We're able to inflate that balloon and hold that for a period of time, and that allows the medication to dissipate into the vessel wall and retard restenosis in that area. From the stent standpoint, we have stents that have medication on them as well, and that stent elutes off of the stent over a period of time, so it can be months to kind of help prevent restenosis. And then we have some newer stents on the horizon that are soon to come out that are dissolvable, so we'll be able to put those in, and then those will dissolve over time and maintain the blood vessel lumen and blood flow during that time period.
Okay. PAD can be a difficult diagnosis for patients. How do you approach patient education and support throughout the patient journey?
So there's been a recent report from the American Heart Association that showed that patients, doctors, the population as a whole is really uneducated about PAD. And it's really a very important disease. PAD has a mortality rate in its advanced stages that's as high or greater than some of the most serious cancers. So it's something that we all need to know about, and most people don't. So we take advantage of meeting with physicians and other healthcare providers to inform them about PAD, the early signs, how to diagnose, and how to treat. We also meet with different patient groups to help educate potential patients. I think this month we're meeting with a couple of different groups. So getting that word out into the community is important. We have a lot of great information on our website, if people can find that. I'm active on social media trying to champion education through social media. We're starting this podcast. So that's another way to educate our local community. And then, especially for this month, we're participating in the Vascular Health Step Challenge, and that's run by one of the societies. So, since it's PAD month, we're walking 60 miles to represent the over 60,000 miles of blood vessels in the human body, and we're trying to get support pledged. The society is trying to raise $60,000 to provide care to underserved areas that need vascular treatment.
Okay, Doc. So if you can tell us a little bit more about how you approach patient education and support throughout the patient journey.
So, medical care is really kind of difficult in this day and age. We as physicians are pulled in a lot of different directions. We have a lot of patients, we have hospitals, we have other physicians, we have insurance companies. And so our patients are really suffering because they're not getting the attention that I think they really need. So we really try hard to not rush a patient through an office visit and take the time to explain what's going on why we're thinking that, what kind of alternatives there may be for the patient. And then we have a lot of great nurses as well to reemphasize some of those points. And I think that what we hope is that when they leave this office, they have a good understanding of what's going on, what's being done about it, and why we're doing it. You can always get more information on our website, www.espadasa.com. That's ESPADASA.com. Well, that's all for today. In future episodes, we're going to be talking more about different aspects of vascular health that will interest all those who care about PAD. I'd like to end this episode from a verse out of Psalms 147:3. He heals the brokenhearted and binds up their wounds. Have a good day.